Africa's health crisis, a battle against multiple emergencies. A continent in crisis, Africa's fight for health security. Africa is currently facing a critical juncture in its healthcare journey, battling multiple health emergencies amidst a surge in global funding for pandemic preparedness. This situation is both challenging and intriguing, leaving many questions unanswered. The emergencies at hand. Professor Jaap Boom, an expert in health emergencies, recently highlighted the dire situation during a virtual press briefing. Africa is grappling with widespread cholera outbreaks, rising Mpox cases, and active viral hemorrhagic fever events, creating a high-threat environment. But here's where it gets controversial. This crisis is unfolding while Africa receives significant global support to bolster its pandemic response. Progress and partnerships. Professor Boom commended the alignment of governments and partners around the Africa Health Security and Sovereignty (AHSS) agenda. He believes that progress depends on delivering at scale and prioritizing Africa's people. And this is the part most people miss. Africa has received substantial funding, with $234 million allocated at a recent Pandemic Fund Board meeting. This funding is aimed at strengthening cross-border surveillance, regional coordination, and community-level monitoring in high-risk countries. Cholera's devastating impact. Cholera has taken a heavy toll on Africa, with over 308,935 cases and 7,131 deaths reported in 2025 alone. This represents a significant rise from previous years, with 5 countries accounting for nearly 88% of all cases. Angola, in particular, has reported over 34,000 cases and 877 deaths this year. Mpox and other outbreaks. Mpox remains a widespread concern, with Africa recording over 132,000 suspected cases and 40,000 confirmed cases in 2025, a stark increase from the previous year. While Sierra Leone has seen a remarkable decline, Liberia is now the main driver of the outbreak. Additionally, Africa is managing outbreaks of Marburg Virus Disease, Ebola virus disease, and Crimean-Congo Hemorrhagic Fever, each presenting unique challenges and requiring immediate emergency responses. The health workforce gap. One of the critical issues highlighted is the shortage of community health workers. Africa currently has only half of the required 2 million workers, which is essential for strong primary health care and early outbreak detection. A recent article in BMJ Global Health warns that fragmented and underfunded programs are undermining Africa's health security. Vaccination efforts and future challenges. Over 4.8 million Mpox vaccine doses have been delivered to 16 countries, with over 1.9 million people vaccinated. However, the increasing climate-linked outbreaks, weak water and sanitation systems, and strained health infrastructure continue to test national capacities. Professor Boom urges partners to sustain their investment and coordination, emphasizing the need to expand surveillance, scale up community health worker programs, and strengthen emergency operations. Africa's future depends on stronger systems, smarter investments, and deeper collaboration. This crisis presents a unique opportunity for global collaboration and innovation. What are your thoughts on Africa's health security and the role of international support? Let's discuss in the comments.